the body part that they are supplying. A lot of these are going to be very familiar. Okay, now there's a couple of reasons for knowing the names of blood vessels. One reason is because this is an anatomy class, and that's part of what we do. We learn the names of things. The other reason is to know what's connected to what. If I start out on this street and I want to end up on that street, okay, there's no Garmin out there for your blood flow. Okay, you have to know it has to go into this vessel and then to this vessel and then to this vessel and this vessel to get there. Okay? Now in your book, they have two different kinds of pictures. They have these kind of pictures, which shows you what approximately it looks like in the body. In my opinion, these are the most important for our purposes. They also give you little schematic pictures. Hold yours up, Elisa. Yeah, you see that thing? Okay, that's called a schematic. Okay, that doesn't tell you anything about what the blood vessel looks like. It only tells you what it's connected to. Okay, so you don't have to do all the twists and turns in the road here. It shows you this one goes to this one, and this one goes to that one, and this one goes to that one. Okay, are those important? Yeah, read through them. But you're going to want to spend most of your time on pictures that look like this. Okay? All right. So, this is the systemic circulation that we're concerned with here. Coming out of the left ventricle, you have the aorta, which is your first big artery. Now, there is a trick question that is often asked on exams, kind of like the hypothalamus pituitary produces what question? Okay, this is another one. If you are asked what the first arterial branch off the aorta is, the answer, coronary arteries. Remember, the coronary arteries sit right down here in the cuffs of the aortic valve, and they are the first branches off the aorta. Very tiny, not something that you see very readily. The aorta continues for about an inch or two as the ascending aorta. That means it's going up that way. And then it turns and goes back down that way. Okay? And this part is called the arch. Another question that is often asked is, what is the first branch off the aortic arch?
Brachiocephalic.
That's a different answer. The first branch off the aortic arch is the brachiocephalic artery. The second branch is the left common carotid, and then the third branch is the left subclavian. Now let's back up here a second. Remember, I said with the heart, if there's a left or a right that's part of the name, you have to give me left or right, or you don't get credit. Some of you guys found that out yesterday on the quiz. You didn't give me a left or a right. Okay? So for the heart, the left and the right is important. For the blood vessels, okay, if the vessel has more than one word in the name, it's important. So, for example, the common carotid. Up here, upstream a little bit, it splits into an internal carotid and an external carotid. So just on this side of the body, you have three different carotids. You have a common carotid, an internal, and an external. So if you just tell me carotid, do I know that you know what you're talking about? No.
You're not gonna act like what comes first, will you?
Right.
So you do second. I kind of lost.
Okay. All right. Now let's back up a second. We said that our first branch here was called the brachiocephalic. Brachio refers to what? The arm. Cephalic refers to what? The head. So this little trunk here is carrying the blood that is going to go to the arm and the head. Okay. So the first branch, the brachiocephalic. Second branch, the left common carotid, and then the left subclavian. The common carotid is going to the head, the left subclavian is going to the arm. So, would you expect to see a subclavian and a carotid somewhere out here on this side?
Yes.
Yes, you would. And the brachiocephalic splits almost immediately into a right common carotid and a right subclavian. Now, what does subclavian mean? Below the clavicles, and that's where you find it. Okay, it's headed for the arm, it's below the clavicles.
Got it.
Now, those of you who are from Gainesville, what's the name of this street right out here?
University.
East University.
East University, okay? East University. Okay, you go down until you get to 13th Street. What's the name of the road? West University. Okay. You keep going out down there somewhere, okay, and it turns into what, Corey? Newberry Road. Is it a different road?
No.
No. When it passes certain landmarks, it acquires a different name. Correct? Same thing with this. When it's passing under the carotid, under this the clavicle, it's called the subclavian. When it enters the armpit here, it's called the axillary. Okay.
Yeah.
When it comes out of the armpit, it's called the brachial. Okay, now Corey, why does that make sense?
It makes sense because it's where it's located in the body.
Exactly. Okay? It takes its name from the landmarks that it's passing. Okay, so when it's under the clavicle, it's the subclavian. When it's in the armpit, it's the axillary. When it comes out of the armpit, it's the
Brachial. Deep brachial.
okay. All right, now deep brachial branches off of the brachial, and you do have branches around joints. Those are called collaterals. Okay. So your blood flows to your fingers no matter how your joint is positioned. Okay? Because there is collateral circulation around the joints. Okay? But your brachial artery, the main one, right down through here. Now, in the arm, it's quite nice because when you get down to the forearm, you split into two major branches, the radial artery and the ulnar artery. Where do you suppose the radial artery is? On the radial side, which is the lateral or the thumb side. Where do you suppose the ulnar one is? On the other side. Okay? Now, when you get down to the palm, the two arteries come together to form an arch or an arcade. So, where do your fingers get their blood supply from? Yeah, either the radial artery or the ulnar artery. Now, in the hospital, when they do arterial blood gases, they have to stick a needle in an artery. Okay. The easiest one to get to is in the wrist. Okay. But they will do this. They will have the person squeeze their hand. Notice how my hand is getting whiter as I squeeze it. Okay. And then they will compress both arteries, and then they'll let one go. Okay. Does my hand turn pink? So that means my radial artery is patent. Do the same thing again. Compress both arteries. And let go of the ulnar one. It's my hand turn, maybe. So that way they don't go screwing up the circulation to the hand. If they only have one artery that is patent and supplying the hand, do you want to stick it with a needle? No, you want to stick someplace else. Okay. So you have both places here that are supplying blood to the hand.
I think that's the most painful thing.
That's the arm, guys.
I would put it like
Is
that short for you gotta have all of the other ones and everything else?
Yeah.
yeah, put it.
She's like,
Okay.
and I'm about to blow your mind with everything.
Okay, now, let's go back to where we started. Here's our aortic arch. Okay. Our first branch off the aortic arch is what? Brachiocephalic, which splits into
The left, no, the right common carotid and the right subclavian.
right subclavian. Okay. Now, notice your common carotid comes up here and it splits into an internal carotid and an external carotid. Your external carotid supplies everything on the outside of your head and your face. And I don't worry too much about these different branches out here because they're kind of obvious. The facial artery supplies what? The face. The lingual artery supplies what? The tongue. The ophthalmic artery supplies the
Eye.
Okay, so it's real. It's like, okay, if you've got an artery right here supplying this, what is it? You know that. Okay. The internal carotid goes up through the floor of the brain, okay, through the foramen lacerum, okay, in the bottom of the brain, in the bottom of the skull, and it supplies the brain. The internal carotid goes up through the foramen lacerum in the base of the skull and supplies the brain. Okay. So you have an internal carotid on each side. So the brain is getting blood from how many arteries?
2.
At least 2. But your brain is kind of important, right? Just a little bit. Okay. So your body doesn't stop with just 2 blood supplies. Notice here off the subclavian artery, you have a little branch that runs up through the transverse processes of these vertebrae. What kind of vertebrae are they? Cervical. Remember, the cervical vertebrae have what in their transverse processes? Foramen. And we said that that foramen was there because there's an artery that runs up through it. Okay? This is the artery, the vertebral artery. On each side, you have a vertebral artery that is running up through the transverse processes of your cervical vertebrae. This is why it's often not a really good idea to have somebody yanking on your neck, okay? Because that's possible to tear that artery, okay? Now, what happens, and I'll show you another picture of this, those 2 vertebral arteries come together in the basilar artery and they help to supply the brain. So how many arteries do you actually have supplying the brain? At least 4. Okay.
1, 2, 3, 4.
Now you may be going, okay, that's fine. I have an internal carotid on this side. I have an internal carotid on this side. I have a vertebral artery on this side. I have a vertebral artery on that side. So what?
And
I have 2 different sides.
Just kidding.
You know, I have 2 different sides here. So how does that help? This is how it helps. I got a bigger picture. Your vertebral arteries are coming up like this. They join together to make the basilar artery. Right here, you have your internal carotid artery coming in. Okay. Everybody see that? Now let's scooch it over and look at this picture. Here's your basilar artery. Here's your carotid arteries coming in.
Oh.
And look at what you have. You have a traffic circle. Everybody see that?
Yeah.
This blood can go this way or this way. This blood can go this way or this way. This blood can go this way or this way. You have a traffic circle. So any part of your brain can be supplied from any of those four arteries, because the blood could just go around the traffic circle to get where it needs to go. This helps to minimize the likelihood of a catastrophic stroke that takes out half your brain. Okay. Now, you guys were asking about aneurysms yesterday. This traffic circle here is a common place for congenital aneurysms, okay, which is not a good thing. Now, these little branches that make up the traffic circle, the back two are called posterior cerebral arteries, the front two are called the anterior cerebral arteries. They're just part of the traffic circle. Okay? And the whole thing is called the circle of Willis. Willis found it.
The book says
Yeah.
communicating artery, and it has the cerebral artery as the one underneath it. It says this is the cerebral, and the circle is the communicating.
This baby is born.
Sorry.
Yeah.
Sorry.
Yeah.
The cerebral.
Yeah, I don't want you to sweat the connections here, okay?
Okay.
Some books will say, okay, this is the posterior cerebral, and then it splits into a communicating. Okay, the circle of Willis has some variations. Okay, different textbooks will mark them a little different. Okay, it's a traffic circle. It's called the circle of Willis. It allows the blood from the internal carotid artery and from the basilar artery to circulate around and join. Okay? When you get to grad school, you can sweat the details of what they're going to call the little junk. Okay?
Why is that a common place for aneurysm?
I don't know. Nobody knows.
Traffic jam.
Okay? Perhaps. Now also notice what's there. Notice what is there. The pituitary gland, and what else? What's this?
The optic chiasm.
The optic chiasm. Okay? So if somebody has a huge, horrible, terrific headache, and then all of a sudden they lose their peripheral vision,
Mm-hmm.
you'd be looking for a hemorrhage right in there. All right, now we said that the aorta had three parts. It had an ascending part, an arch, and a descending part. The problem with the descending aorta is that it covers an awful lot of territory. So the descending aorta is further divided into a thoracic aorta and an abdominal aorta. Isn't that nice? It's very obvious. A thoracic aorta and an abdominal aorta. Okay, now let me ask you a question. Oh wait, it's only 10:30. Never mind. Okay. All right. Now the branches off the thoracic aorta are also kind of obvious. Okay. They go to the mammary glands, they go to the lungs. The bronchial arteries supply the lung tissue. When you get down below the diaphragm, though, things get a little more interesting.
Can you point to the thoracic aorta on your picture? And then the other one's called?
I wish we had that picture in our book. That's lame.
It's all divided. Yeah, it's a little skinny, like.
The things that should be put together aren't, and the things that should be separated aren't. They're terrible at this job.
Same height separated from the diaphragm.
All right, now, when I was in med school, I had a really good lab partner. He was cute, and he was a football player, and he went on to become an anesthesiologist. And I
We're
know...
not the cute smart ones, you know?
They, I'm not sure I understood what she said. I don't understand why that was funny. When our instructor went over this part in medical school, she said, the arteries in the abdomen are like this. And then she left it at that, and I'm going, really? Okay. I know that you're going to ask us more than that on the lab exam. Come on. Okay. So we got down to the lab, and I said, I'm cooked, I'm toast, I'm done. I don't understand the arteries here. He said, it's not a problem. Okay. This is the way it works. Okay. There are arteries that supply, well, back up a minute. There are three main arteries that come off the aorta. There are three main arteries that come off the aorta. 1, 2, 3. Okay. This first one here is called the celiac trunk. The celiac trunk divides into 3 arteries: the hepatic artery, the gastric artery, and the splenic artery. Where do you suppose the hepatic artery goes? To the liver. Where do you suppose the gastric artery goes? To the stomach. Where do you suppose the splenic artery goes? To the spleen. The spleen. Okay. Piece of cake. Now, there are some funky branches of the gastric artery, which we won't worry about. You don't need to worry about if unless you're going to be a general surgeon. Okay. But the celiac trunk is the first big branch that comes off, and it gives 3 arteries, and it's real obvious what those arteries belong to. The second, this is number 1. Number 2 over here is the superior mesenteric artery. And remember, I said that if the artery has more than one name, it's important, right? What do you suppose superior mesenteric means? It means that there's an inferior one somewhere, right? Okay. Inferior is number 3. Mesenteric refers to what? It refers to the connective tissue that's attached to your guts. The superior mesenteric artery supplies all of the small intestine and most of the large intestine. The superior mesenteric artery supplies all of the small intestine and most of the large intestine. That's most of your guts. And it does wind all around in crazy ways to get where it's going. The inferior mesenteric artery supplies the last portion of the large intestine and the rectum and the anus. large portion, the last portion of
Large
the large intestine, okay? The left side of the large intestine,
Mm-hmm.
the sigmoid, and the rectum. Okay, is that hard? No, not really. I didn't think so either. Right? My blood pressure went right back down to normal. Now there are a few other arteries here that branch off the aorta. There's one to the adrenal glands on each side. What do you suppose that one's called? An adrenal artery. There's an artery to the kidneys on each side. What do you suppose that one's called? The renal artery. Okay. And then there's one to the gonads on each side. And what do you suppose that one's called? The gonadal artery. Okay. Again, piece of cake. Okay. Now, notice though, the blood supply from the gonads is way up here in the abdomen, not down here in the pelvis.
Yeah, why?
Okay? Because the gonads start up here in the abdomen and then they travel, both in men and in women. The ovaries are often in the abdomen in baby girls, end up in the pelvis. Okay. The testicles are sometimes in the pelvis in baby boys. They're supposed to end up where? Outside in the scrotum. Okay, so they travel and they drag their blood supply with them.
So it grows.
Yeah. Okay, so going back and looking at a picture like this, or like the one you got in your book, which is fairly messy. Okay. They're trying to stick all the different organs on there, and it's harder to see what the blood supply is because the blood supply gets stuck back behind the different organs that you're talking about. Okay, and your book does something similar. All right, so the abdominal aorta, supply to the guts. Now, here's our abdominal aorta coming down, and it splits into a left and right common iliac artery. Now, what did I say about arteries that had more than one name? Very important because you need to know both. Did we see another artery that had the name common? Which one
Common
was it?
carotid.
The common carotid. And then what did the common carotid do?
Split.
Into
Internal.
an internal and an external. What do you suppose the common iliac does?
Internal and external.
Splits into an internal and an external. Okay. The internal iliac artery ends up going down here into the pelvis and supplying the pelvic structures. And we're not going to spend any time on the internal iliac artery because we're going to see it again in repro. The internal iliac supplies the uterine arteries. It supplies the bladder, okay, all the structures that are in the pelvis except the ovaries. Okay. And you have the external iliac artery, okay, and the external iliac artery is a little bit like our street out here. It changes names when it passes landmarks. Okay. When it passes underneath the inguinal ligament here, it's now in the what?
Femoral.
In the leg, and it's called the femoral artery. The femoral artery and the femoral vein and the femoral nerve are right under the skin here. They're right under the skin here. That's why, as this last war went on, you saw body armor going from things that wrapped around like this to things that hang down in the front. Okay, it was not just to protect their precious balls. Okay, it was to. That was so sensitive. It was to protect their femoral arteries. Okay, it was to protect their femoral arteries.
You said the abdominal aorta splits into two, the common iliac artery and the,
Right, common iliac on both sides.
okay,
Right.
and then and left and right, and then from left and right, it splits into internal and external.
Of iliac.
Okay, so you have a common iliac on this side, a common iliac on that side, Corey. Splits into internal iliac, external iliac on this side. Same on the other side.
So would we have to label the left common iliac artery, right?
To be most correct, yeah, but I'm most interested in common iliac, internal iliac, external iliac. Now, in grad school, a lot of times what they will do, you have to give left and right, you have to give a complete name, and you have to give artery, vein, muscle, or nerve. If you don't have all of that correct, you don't get any credit for the question. Okay, so, I don't want to be that hard on you. Okay, you have collateral circulation around the hip joint again. The femoral artery continues. When it gets down to the knee, behind the knee, it turns into the popliteal artery, and then it splits into the anterior tibial artery and the posterior tibial artery. Now, where would you expect the anterior tibial artery to go? On the front of the tibia. Where would you expect the posterior tibial artery to go? On the back. Okay. Now, the posterior tibial also gives off a fibular branch, and where would you expect that to go?
On the side of the fibula.
To the fibula. Okay, so you end up here with sort of an arch sort of deal around the foot as well. Now, that picture is not as clear as it is with the hands, but this is an arch here. So, those of you who are nurses know this already. When you do pulses in the foot, you put your fingers 2 different places, correct? Okay. One place you put your fingers is behind the medial malleolus. That's called the posterior tibial artery. The other place you put your fingers is right on top of the foot, okay, and that's called the dorsalis pedis artery. Just like on the hand, okay, you had your radial artery and you had your ulnar artery, and you could check both to see whether you had circulation to the hand. With your foot, you check your posterior tibial artery and your dorsalis pedis artery. They're they come from 2 separate arteries, and they make up the arch of your foot. Now, sometimes you can feel one of these and you can't feel the other. That's especially common in elderly people. Sometimes you can't feel them at all. You have to go get a Doppler. Okay, these can be a real pain in the behind, okay, especially in elderly people, because they can be very hard to feel. Okay, guess what? That's the arteries. So let's look at the veins.
Yes. Okay, now it made sense to start with the heart and the branches off of the heart, because we were talking about arteries and the blood is coming from the heart and going out. Okay. With the veins are gathering blood in and directing it back to the heart, right? So let's look at the general areas that blood is being drained from and go back towards the heart. So, in the brain, you have arteries and veins. You have meninges. We say that the arteries from the brain were more likely to be located either inside the brain or in the subarachnoid space. Remember that? The veins were more likely to be associated with the dura mater. There are venous sinuses in the subdural spaces. So that's why we talked about a subdural hematoma being a little different from a subarachnoid hematoma. Okay? So in the falx cerebri, which is the part of the dura mater that hangs down between the two halves of the brain, you have your superior sagittal sinus. In the back, you have a junction here of your sinuses. Okay, you have a cavernous sinus right here, just close to where the pituitary gland is. All of those come together, and then they exit the brain through the jugular foramen as the jugular vein. And there's a jugular vein that comes out on each side. Now, the portion of the jugular that is draining the brain is called the internal jugular. Why does that make sense? Because the corresponding artery was the internal carotid, right? So it's the internal jugular. If there's an internal jugular, you would expect there to be an external jugular, and there is. And guess what it drains? The face and the outside of the head. The face and the outside of the head. Okay. The two come together to form the common jugular, which isn't even listed as that. Okay. So here's your internal jugular, here's your external jugular joining it. And then it comes in and joins the subclavian vein. You also have a little vertebral artery running the same place that your you have a little vertebral vein running the same place your vertebral artery does. And also joining the subclavian. Which, with a name like subclavian, where would you expect it to be coming from? The arm. Okay. So here you've got the drainage from the head joining the drainage from the arm. They both come together to form the superior vena cava. And the superior vena cava empties into the right atrium. Okay, now, you will notice if you're going through here that there are more veins than there are arteries. That's because there are more veins than there are arteries. Each body part needs an artery. Each body part also needs a vein. But remember, the blood in the veins also carries heat to the skin and to the surface of the body. So, in general, there are deep veins and there are superficial veins. The deep veins are usually associated with your skeletal muscles, and the deep veins the muscles help to squish on those deep veins and propel the blood on back to the heart. The superficial veins are located under the skin. They are not as big. They aren't usually associated necessarily with muscles. You use them to get rid of heat. What else do you use the superficial veins for? Blood storage. And a nifty place to stick a needle. A nifty place to stick a needle. Okay.
So when someone says you have deep veins, that's
It doesn't mean anything. Okay. Now, can you stick a needle into a deep vein? Yeah, if you're really, really good. Okay. Most of us are just happy to get it into a superficial vein. Okay. All right, so our right subclavian vein, our right axillary vein, our brachial vein. But now notice we've got some split out here. We've not only got a brachial vein, we have a cephalic and a basilic vein. What's with that? Well, cephalic and basilic are more superficial than the brachial. Now, let me show you something. Your limbs develop as little paddles sticking out here. On my little paddle that's sticking out here, the paddle has an end that's toward my head, right? A cephalic end. And it has an end that's away from the head. It has a basilic end, right? My paddle grows out like that to form my limbs. The veins go along with it. So on this side, I'm going to have what kind of a vein? A cephalic vein. On this side, I'm going to have a basilic vein, and then I'm going to have a brachial vein in there too, because I have a brachial artery, right? Okay. So you have your cephalic vein, your basilic vein, and your brachial vein. Now your brachial vein is the one that you're usually poking at in your antecubital space here. Now, there are a couple of things in your antecubital space that you don't want to hit. You don't want to hit your biceps tendon. And median nerve and the brachial artery. Okay? You don't really want to hit the brachial artery either. So when you stick a tourniquet on there, you wait for the purple thing to pop up. Okay? That's going to be your vein. Okay? So you don't just go slam a needle into your antecubital space, because there's lots of stuff in there you don't really want to hit. Okay? Also, you don't really need to go deep into the antecubital space. You're after where the vein comes close to the surface. The median cubital vein there is close to the surface. Okay. All right. In the forearm, you have a cephalic vein, you have a basilic vein, you have an ulnar vein, you have a radial vein, and then you have a venous arch in the hands. And everybody has different branches off of these. That's why you have to use a tourniquet instead of a ruler on somebody's arm. Okay? Everybody's vein pattern is going to be a little different. Okay? So you have to use a tourniquet to see what's actually there. Okay, so the blood flow from, or the blood return from the brain and from the arms goes into the superior vena cava ultimately. Everything else comes back to the heart in the inferior vena cava or the cardiac vein, right? Okay. So you have a big vein down the middle of the body. It runs along with the aorta. This big vein is the inferior vena cava. And each of these organs also has veins that come in to the inferior vena cava. So you have a renal vein from both of the kidneys. You have an adrenal vein from both of the adrenal glands. You have hepatic veins. You have gonadal veins. But notice you don't have mesenteric veins coming in here. Where are those mesenteric veins? Where's the vein from the stomach? Do you want everything that you put into your stomach to end up in your bloodstream? No. So what your body does, all of the venous drainage from the stomach, from all of the intestines, okay, you have an inferior mesenteric vein, a superior mesenteric vein, you have a splenic vein, a gastric vein, all of those. All of them come together as the hepatic portal vein, and that blood goes into the liver.
Oh, yeah.
So all of those body parts that had an artery, they all have a corresponding vein as well. But that vein doesn't dump right back into the inferior vena cava. All those body parts send their blood to the liver first. So all those veins come together as the hepatic portal vein. Now what's a porter? Somebody totes your luggage around, right, for you? Okay. So the hepatic portal vein is doing what? Moving stuff for you where? Into the liver. Okay. The hepatic portal vein is moving stuff into the liver. Now, the liver does all kinds of magic stuff. One of the things it does is detoxify things. Okay, so it makes total sense for all this crud that you've been dumping in your stomach to go through the liver first before it gets circulated through the body.
Mhm.
So the liver does its thing, and then the blood returns to the inferior vena cava. What would you call the vein that comes from the liver into the inferior vena cava? The hepatic vein. So you have a hepatic vein, and you have a hepatic portal vein. What's the difference? One's going into the liver, one's going out from the liver. Okay.
For some reason, I think of porta potty, and I think, oh, that's all the nasty stuff, so it's going into the porta.
There you go. That works. There you go. Okay. Now, you need to know this. You're going to be asked. Okay. You're probably going to be asked on both the lecture exam and the lab exam. Okay. So get it straight now. Okay. When you get up there looking at body parts, okay, find it. Okay. So you know which one it is.
I'm a little bit confused about how the splenic, all the mesenteric, how are they,
Okay.
branching off of the hepatic portal vein? Is that what you're saying?
No.
I'm
No, they're
confused
going
about that.
Okay. You have your colon, the left side of your colon, rectum. All that is drained by the inferior mesenteric.
Okay.
All the rest of this, they've cut off the rest of the small intestine and the first part of the large intestine. All that is being drained in here by the superior mesenteric.
Okay.
You have your splenic grabbing along behind the stomach. You have your gastric vein wherever they've got it. Okay. All of these come together
At the hepatic portal.
at the hepatic portal
Okay.
vein. Okay. And it's difficult to illustrate that without making a very messy picture. Okay? Got it?
It's amazing to me that all this fits inside our body. There's so much. Like, we're just seeing the
Yeah.
photo with the veins, but it'd be cool to see a photo with it all together.
I know, that's
Yeah, that's why.
this one might, Jess, this one might be easier to see.
Okay.
Okay. Here you can see they've got,
Yeah,
they've
that's
still
nice
got stuff
photo.
cut out, but you see here's the inferior mesenteric, here's the superior mesenteric, the splenic, the gastric, okay, and all of them come into this hepatic portal vein here.
Yeah, that's a nice one.
Okay. And then your hepatic vein comes in there.
Oh, yeah.
Okay.
Keep that out, but not just that.
Oh, I know. But then that makes you think, why? It makes you, it's the same for the placenta.
Okay, now I want to show you something here. We said that the renal veins empty right back into the inferior vena cava. But notice what the gonadal veins do. Your right gonadal vein comes right into the inferior vena cava. Your left gonadal vein joins the renal vein, and then it sort of goes around the block to get the blood back into the inferior vena cava.
Why?
Now, one reason for having veins is to return blood to the heart. The other reason for having veins is to circulate or to get rid of heat. Correct? Okay. This doesn't make a whole lot of difference in terms of the ovaries, but when in terms of the testicles are out in the scrotum in the first place so that it's cooler. They function at cooler temperatures. So if the blood coming back from the testicles, which is carrying heat, takes a different route on both sides, which side gets rid of heat the most effectively? The most effectively.
The right.
The right, okay, because the right's getting rid of the blood most effectively, the most fastest, okay, most direct shot, okay. So all other things being equal, how are the testicles then going to sit in the scrotum?
Ah.
One's going to hang a little lower because it's going to be a little further away from the body because they can't get rid of the heat as well.
But in a female, it's the same.
In the female, it doesn't matter. The ovaries are
Right, but there's still.
yeah, the veins
like
are the
this.
same. All right, we're almost done.
I had no intentions of eating that full thing. Boy.
Right. No, we're almost done. All right, our inferior vena cava splits. Okay, I don't want to repeat myself because you're talking. Okay, your inferior vena cava splits into a common iliac vein. That's nice because you also have a common iliac artery, right?
Mm-hmm.
And you got the same doobie-doo here. You've got an internal iliac vein and an external iliac vein, and they do the same thing. The internal iliac vein is draining structures from the pelvis. The external iliac vein is draining stuff from the legs. Once you get under the inguinal ligament, the external iliac vein becomes the femoral vein. And again, it's a huge vein. And it's right underneath the skin. So, for example, when they do cardiac caths and things like that, where they're putting equipment up through the veins, they need a large vein to do that, and the femoral vein is the easiest one to get to, so that's the one they usually use. Okay. Again, you have collateral circulation around the joints, and again, you have a set of deep veins and a set of superficial veins. Your deep vein here, you have your femoral. It becomes your popliteal.
When they put stents in the heart, don't they go through? Is it the femoral vein and then they travel up?
Depends on which side of the heart they're headed for.
Mhm.
Okay, your popliteal vein, and then your fibular vein, and your, which eventually becomes your dorsalis pedis down here. But this one is the one I want to draw your attention to. This is the saphenous vein. The saphenous vein runs just anterior to the medial malleolus. Now, what do you know about the medial malleolus? What did we just say was behind it? The posterior tibial artery is behind it. In front of it, you have the saphenous vein. Okay? And as we talked about yesterday, you can usually feel it right in front of your ankle bump there. It's just under the skin, and it's a fairly large vein as these veins go. Okay? It can be an easy place to do a venous cut down if a person's blood pressure is so low that their veins won't pop up when you put a tourniquet on. This vein runs under the skin all the way up here on the inside of the leg, and sometimes they harvest that vein. In other words, they cut all along it and take it out and use pieces of it when they do coronary artery bypass grafting. Now, there are lots of branches off of these. Okay, so when you have blebs on them, what are they called? Varicose veins. Right, now, something else I wanted to say about that. Oh. When blood does not move properly within a blood vessel, it can clot. The clot is called a thrombus. The problem with a thrombus is it can break off and travel, in which case it would be called an embolus. In the superficial veins are so small that if the blood clots in one, it doesn't really do any harm. But the deep veins are usually bigger, and there's usually more of a straight shot towards the heart. So when you have a deep venous thrombosis, that's when you have a problem. Deep venous thromboses are not uncommon in pregnancy, and they're not uncommon postpartum either. Estrogen enhances the ability of the body to clot. So pregnancy, childbirth, birth control pills, hormone replacement therapy, all of that can lead to deep venous thromboses. Now, have you ever heard that physicians don't like to have their pregnant patients fly?
Yes.
Okay. Do you know why that is?
It can release the blood clot.
Okay, it doesn't have anything to do with the amount of oxygen. Okay, it has to do with the fact that the longer you spend all cramped up like this, okay, when you're pregnant, the more likely you are to develop a deep venous thrombosis, which can kill you. Okay, it doesn't have anything to do with the oxygen, pressure, any of that. Okay.
Oh.
All right.
Office jobs, that would be the same.
Same thing. The thing is that when people are left to their own devices, they'll get up and walk around when they get uncomfortable. A lot of OBGYNs will say the same thing about long car trips. Okay. Get out. Now, has anybody looked on ThinkWave lately? Are any of these pictures up on